Good morning. I'm Jeremy Garza. I'm the 2nd Ward City Councilman here in Lansing, Michigan. And I'm proud to be here today because I want to share some exciting news with you. I want to begin by thanking Father Vincent and his team here at Cristo Rey Church for allowing us to host this event here today. This is a very important parish in Lansing and very important role in our community. Not only as a house of worship, but also by serving as a site of many free clinics where people are getting their COVID vaccinations. Like all Michigan communities, Ingham County and the city of Lansing are working tirelessly to ensure that we get as many of our residents vaccinated as possible. More than 57% have initiated the vaccinations in Ingham County, and over 53% have completed their vaccination. As one of the leaders in the Latinx community, I am proud that statewide, more than 40% of Hispanics receive immunizations initiation, with over 34% completing the process, which is roughly on par with what we're seeing here in Ingham County. We're doing a great job, but we need to keep going because like many Michigan communities, we've seen a slowdown number of people actually getting the shots in their arms. This is especially true in the Hispanic community. I'm confident the new initiative that Governor Whitmer is announcing here this morning is going to reverse that trend. Now, it is my honor and privilege to introduce the governor of the great state of Michigan, Governor Gretchen Whitmer.
All right. Thank you. Thank you. Today is a really good day. I am so excited about this, and Councilman, I appreciate you getting us kicked off here, and Cristo Rey for hosting us. This has been an important community effort across the state of Michigan. We've all been a part of getting to this point. We are in a strong position compared to where we were a year ago, and yet we do have some more work to do, and today's announcement is an exciting step toward accomplishing our goals of getting more people vaccinated, getting everyone back to work, and getting this economy invigorated. So, today we are launching the My Shot to Win Sweepstakes to get vaccinated. My Shot, M-I, the Michigan Shot to Win. The sweepstakes is powered by Meijer, and it is in partnership with the Michigan Association of United Ways and the state of Michigan. This is going to be a chance for Michiganders to get registered and to be eligible for $5 million in cash prizes and college scholarships. It's really exciting, and we're proud of this collaboration with Meijer and the work that they are doing, and this is backed by a number of different partners that we have, including Blue Cross Blue Shield of Michigan, the Michigan Chamber of Commerce, the Michigan Association of State Universities, the Small Business Association of Michigan, Business Leaders of Michigan, and the Protect Michigan Commission, and many more organizations who have been instrumental in our being able to pull this together. So I want to thank them all for the work that they have done. And Carrie Ebersol, who's been our quarterback. Phenomenal effort going into making this happen. Because I know that we are tapping into our competitive spirit as Michiganders. I know some of you must be thinking, didn't Ohio do this first? Well, yes, they did. But in typical Michigan fashion, we wanted to do it bigger and better than they can do it in Ohio. And that's what we are here to announce. So the My Shot to Win sweepstakes will save and change lives. Right now, over 62.4%, nearly 5 million Michiganders, 16 and up, have gotten at least their first shot. Now, from the start, our vaccination goal has been 70% of Michiganders who are 16 and up. With the sweepstakes, we hope to increase our rate by that 9%. Roughly 700,000 more Michiganders so that we can get to that 70% rate. So, who can enter? I know that's a big question, and I got that question this morning when I was doing an interview. Michiganders who have gotten at least one shot, one dose of their safe, effective COVID-19 vaccine between December 1st of last year and July 10th of 2021 can enter. So even if you've already had one or both of your shots, you can register to enter now. And the site is live. I think my friend from Meijer told me, yes. All right, the site is live. Any Michigander 12 and up who has gotten vaccinated is eligible. For those 12 to 17, a parent or guardian has to get you registered, but you are eligible to win. Employees or independent contractors with Meyer who are directly involved in operations of the sweepstakes and employees of independent contractors with the state of Michigan assisting with the sweepstakes are not able to participate. So I'm not going to get registered, but I encourage all of you to. There are 2 ways to sign up. You can do it online or by phone. To sign up online, you go to myshot2win.com and fill out the form. myshot2win.com and fill out the form. To enter on the phone, you can use the COVID-19 hotline at 888-535-6136. Now, the reasoning behind this sweepstakes is simple. We want to keep Michiganders safe. We need to incentivize more of us to go and get vaccinated. You can walk into most places now and get your first shot today, and then go get registered. And although we're taking steps forward in our metrics and we are in a strong place at the moment, if you've not gotten the vaccine yet, the virus is still a very real threat to you. Right now, the Delta variant of COVID-19 is in the U.S. and is present here in Michigan. And Dr. Fauci warned us that this variant is our greatest threat and will become the dominant strain in the U.S. soon. It's so much easier to catch. And that's why if you've not yet gotten vaccinated, today is a good day to get vaccinated. So, I know we all want to enjoy this summer to its fullest and have that pure Michigan summer that we weren't able to enjoy to its fullest last year. And I'm excited to be outdoors and to thinking about the school year that starts in 8 to 9 weeks. Currently, kids under 12 can't get vaccinated, but for their sake, I urge you, if you've got children that age at home, to go get yourselves vaccinated if you're not yet. If you get your first dose of Moderna, full immunity is just 6 weeks away. For the Michigan-made Pfizer vaccine, it's 5 weeks away. And for Johnson & Johnson, it's simply 2 weeks away. All well in time for the beginning of the school year. So I know you've probably heard this pitch before, but I'm going to keep making it until we hit our goals. These safe, effective COVID vaccines will keep you and your family and your community and our state and the most vulnerable among us safe from COVID-19. It's okay if you still have some questions. We want to get those questions answered. The vaccine is safe. Over 179 million Americans have already taken it, including over 62% of Michiganders of all races, ages, and ethnicities. It's been rigorously tested and trusted by doctors. And like other vaccines before it, like for polio or for smallpox, the vaccine represents hope and healing. And if you want to know more, I encourage you to talk to your healthcare provider and get your questions answered. We'll continue to make efforts to reach people where they are, partnering with organizations all across the state and getting into neighborhoods. So we're all ready and excited to have a wonderful 4th of July weekend and a great summer. And I know it's tempting to look at these low COVID numbers we have right now and think this is all behind us. Thanks to the sacrifices and efforts of so many, today we have this collective sense of optimism and relief. But we still have more work to do. This is a tremendous opportunity for Michigan. We can advance our economic jumpstart by getting more people vaccinated. We know the effective vaccines are essential to our comeback. And I want to remind everyone, if you have been vaccinated, you are eligible too, but you need to get registered. And I wanted to reiterate that because I perhaps said it wrong this morning on an interview. So I want to make sure people know you're not automatically registered. You need to go to the website, the Michigan website, and get registered now. So now I know you're most interested in hearing more about the prizes. And so I will turn this over to Carrie Ebersol-Singh, the Director of Protect Michigan Commission, and the Director of Michigan Department of Health and Human Services, Elizabeth Hertel, to talk to us about prizes. Thank you.
Good morning. It is an exciting day, and while this has been challenging work, I think the best part of this work, it's about partnership. And here, I know the governor's referenced some of the organizations involved. This is the business community, the nonprofit community, community-based organizations, and government supporting, coming together in partnership to get us to goal. So I love that, and again, want to give a special shout out to our sweepstakes that is powered by Meyer in partnership with the Michigan Association of United Ways and the state of Michigan. Amazing team at DHHS led by Director Hertel, and of course our friends at Blue Cross Blue Shield, the Michigan Chamber of Commerce, Michigan Association of State Universities, Small Business Association of Michigan. We got Brian Calley here. I'm sure he's ready to answer some questions. And of course, Business Leaders for Michigan and a number of organizations around the table for the Protect Michigan Commission. So the prizes, I'm just going to cut to the chase to give a little bit more details there. So the giveaways include $1 million drawing. This prize is for Michiganders 18 and older. $1 million will be awarded as a check or electronic transfer to the confirmed winner. We have $50,000 daily drawings. You ask how many days? 30. We're going to do 30 $50,000 daily drawings. Again, you must be 18 and older to win, and we must obviously check your vaccine status in our MICR. We have the $2 million pot. Okay, again, anyone that has been vaccinated, that is kind of our grand prize at the end of the summer. Again, 18 and up, eligible to win that, and obviously 1 dose of vaccine. Then there's the scholarship drawings. We are offering 9 scholarship drawing prizes available for Michiganders between the ages of 12 and 17. Each scholarship drawing prize consists of a 4-year Michigan Education Trust charitable tuition program contract that may be used to pay for tuition and mandatory fees at a college or university in accordance with met terms. And we have Robin Lott that's going to talk more about that later. The sweepstakes will begin today. So I saw a couple folks on their phones. I don't know if they're taking notes or if they're registering, but we start today. So, and we want to encourage folks to go to the My Shot to Win website to check out any further questions around details. So, with that, again, this is all about getting to 70% and beyond of vaccinated Michiganders, safeguarding our communities and families and our future here. So again, this is not possible without Director Hertel, so I'm excited for her to expand more. There you go. Oops, maybe
No problem. Thank you, Governor Whitmer, Councilmember Garza, and Director Ebersol. We have made incredible strides since the beginning of this year, and certainly since this time last year. People across the state have done their part by wearing masks, avoiding gatherings and distancing, and in just 7 months, millions of people have been vaccinated. Last month, we were able to lift the gatherings and mask orders earlier than anticipated, and we continue to return in person to the people, activities, and places that we love. Our data trends reflect Michigan's progress on COVID-19 and the positive impact of the vaccines. The numbers do continue to change, but as the governor mentioned, we're over 62% of residents who have received 1 dose, and that's almost 5 million Michiganders who are vaccinated. As the number of our vaccinated people increase, our COVID-19 numbers decrease. And as of this week, our case rates have declined to 13.1 cases per million, with rates declining all over the state. The number of outbreaks that we've identified is also down 42% since just last week. However, we are seeing the rate of vaccination slow, and we are tracking the spread of variants, in particular the Delta variant, as we're seeing what's occurring across the world. And we do have that present in the state of Michigan. So vaccines continue to be our path forward, and we still have work to do to make sure that we reach at least 70% of eligible Michiganders. But I am optimistic that we will get there, and that the research is telling us that these vaccines are safe and effective. Of the millions of people who've been vaccinated, less than 1% of those individuals test positive for COVID-19 after vaccination. And of those who test positive, very few end up seriously ill or hospitalized. That's an incredible, incredible reason to get vaccinated. So this sweepstakes is one more incentive, and there are 2 special organizations that deserve some recognition. We could not have launched this without our partnership with Meyer
and the Michigan Association of United Ways. Meijer is definitely one of the organizations that has been at the forefront of partnership with the state to end this pandemic. And first, partnering with us at our mass vaccination clinic at Ford Field. On behalf of the entire state of Michigan, myself and the Department of Health and Human Services, I would like to thank Meijer for all of their assistance. In addition, I'd like to thank Blue Cross Blue Shield, the Michigan Chamber of Commerce, the Small Business Association of Michigan, Business Leaders for Michigan, the Protect Michigan Commission, and all of our other external partners who have helped us not just on vaccinating Michiganders, but in our response to COVID-19 for the past 16 months. So if you haven't been vaccinated yet, and you do have questions, that's okay. Talk to your healthcare provider, go to our website, talk with your friends and families about what they've experienced, and after you do, I hope that you will sign up and walk into one of our many clinics across the state and get vaccinated. And then remember to register at My Shot to win your prize. Thank you so much. And with that, I'll turn it over to Mike Larson, President and CEO of the Michigan Association of United Ways.
Good morning. I'm Mike Larson, President and CEO of the Michigan Association of United Ways, and I'm honored to be among this incredible community today and every day as the state of Michigan continues to fight against COVID-19. At Michigan Association of United Ways, or known as MAU, we know that healthy communities require healthy people. As we enter into a new phase of COVID-19 pandemic, we are thrilled that the COVID-19 vaccine has made positive impact throughout the communities we serve. But there is more to be done. Alongside Meijer and Blue Cross Blue Shield, we are excited to be part of My Shot to Win. My Shot to Win is a great way to encourage fellow Michiganders to take advantage of easily accessible, safe, and effective COVID vaccines. The Michigan Association of United Ways is a partner in developing powerful responses to current and emerging issues, including COVID-19. When communities needed immediate assistance in the first months of the pandemic, our 39 local United Ways were there to answer the call, raising and distributing tens of millions of dollars to keep families and communities afloat. Michigan Shot to Win helps take this work further, ensuring the continued health and well-being of Michigan communities. United Way has always fought for the health, education, and financial stability of every person in every community. As the pandemic continues, so does our critical work in helping the most vulnerable in these tough times. We are working to reimagine and rebuild strong, healthy, equitable communities through new thinking, new partnerships, and new approaches. It will not be easy, but it is necessary because our communities deserve nothing less. On behalf of myself, our board of directors, and the entire Michigan United Way network, we are proud to be part of My Shot to Win in our continued efforts to bring the importance of the COVID-19 vaccine to our communities and those who need it most. Now I have the pleasure of welcoming two of our partners to the podium, Dr. James Grant, Blue Cross Blue Shield of Michigan's Senior Vice President and Chief Medical Officer, and Richard Studley, Michigan Chamber of Commerce President. Thank you.
Well, thank you, Mike, and Governor, Elizabeth, Carrie. Every time you kept saying, ask your health care provider, I kept looking around the room. Is it possible I'm the only healthcare provider in this room? And am I going to be inundated with the questions? But if I am, that's a good thing. And if there's other healthcare providers, feel free to stand up and show who you are. But thank you, everyone. This is really, really a great day. And I'm going to talk to you as a physician. I'm going to talk to you as a healthcare provider. I'm going to talk to you as a father. I'm going to talk to you as a husband. I'm going to talk to you as a son. I strongly encourage everyone who's eligible to get the vaccine, because it's the best defense, the best line against COVID-19. Of course, prevention and mitigation are still extremely important, but the vaccine offers a level of protection pretty much unmatched by any other modality. Blue Cross Blue Shield supports vaccinations for all Michiganders. We are excited to be here today. We are excited to be able to actually say that Blue Cross Blue Shield covers the administration of the vaccine. So no one should get a bill for the vaccine. December the 14th, we launched the COVID vaccine. Since the spring, the vaccine program has greatly expanded through federal and state efforts and both public and private partnerships. And now, I'm really happy to say, it's being administered in retail pharmacies, public clinics, doctors' offices, hospital outpatient sites, nursing homes, and more. And 12 and 12, on May 12th, age 12 and up, we're eligible to receive the COVID-19 vaccine. And as of today, as Director Hertel noted, more than 4.9 million residents, or 61.4% of the eligible population, has received at least one dose of the COVID vaccine in Michigan. But we still have more to go. We still have to meet that threshold. That threshold still hasn't been met. That threshold, what we call herd immunity, is where we're on our way to. So people ask, is this safe? And I understand when you ask that question, but I'm telling you it's safe. I got the vaccine. My wife got the vaccine. My parents got the vaccine. My kids got the vaccine. My loved ones, my friends got the vaccine. I wouldn't recommend anything to anyone else that we didn't do for ourselves personally. And there's a variety of reasons we understand that you put off the vaccine, but it's important to know the FDA doesn't release vaccines that haven't been fully vetted, that haven't gone through all the strict processes. And this is why we can tell you the vaccine is safe. So people say, but it went through so fast. One of the beauties is some of the initial research has been going on for quite a while because this virus is very similar to what we call SARS, severe acute respiratory syndrome. So a lot of the work was already in progress. We just had to take it through to that finish line. And one of the great things is, in the beginning, we didn't have enough vaccine. We have plenty now. We have plenty of vaccine. So a lot of places are offering the vaccine, including your doctor's offices, your local health departments, and pharmacies, such as our friends at Meijer. It's usually best to schedule an appointment. Usually you get your appointment for the first one and the second one at the same time, but some are even allowing walk-ins. So one last thing about herd immunity, where we're trying to get to. Herd immunity has been effective. It's been effective against measles, mumps, polio, chickenpox, amongst so many other infectious diseases. We just have to get to that point now with COVID. Herd immunity is going to make it possible to protect our population from the disease and be able to get it so that the point those who can't get it, those who are immunocompromised, newborns, they'll be safe from COVID. So the only thing I can say is go out and register, get on there, get your friends to get the vaccine. It's safe, and as the state of Michigan is going to do it, we're going to cross that 70% line, and we're going to go even further, and it's going to be thanking all of you for everything you've done to get our population vaccinated and safe. And on that note, I'm going to turn it over to Rich Studley from the Michigan Chamber of Commerce.
Thank you. Good morning. First, I want to thank the Cristo Rey Parish for hosting this important Good News event. As a longtime Lansing resident, I know the extraordinary work this parish does to support family and faith and to make our community stronger. It is also an honor and a privilege to be here today to support the My Shot to Win Sweepstakes, and I'm especially grateful to the leadership that's been provided by the Michigan Association of United Ways, our friends at Meijer, and others who are here today. Governor, when I think back a year ago or more, no one in this room could have imagined the challenges that we would face as a state and as a country. What have we learned? Michiganders are smart and tough and resilient. And when we are challenged to work together, there is very little, if anything, that Michiganders can't accomplish when we focus on working together to move our state forward. So, Governor, I want to express the Michigan Chamber's full support for this sweepstakes. And as you said, I did hear there was a state to the south that tried something like this. We'll learn from their mistakes and do a better job. And I have great confidence in you and your team. In January, I was appointed to the Protect Michigan Advisory Commission. Thank you for that opportunity. We've tried very hard to listen and learn. At the Michigan Chamber, our members employ over 1 million Michigan residents. And today, Governor, because of your support to reopen Michigan safely, companies across the state, small businesses, medium-sized companies, Michiganders are rolling up their sleeves and getting back to work. A couple of months ago, my wife and I had the opportunity to roll up our sleeves and get a shot of Michigan-made Pfizer vaccine at the Meijer store here in Lansing. It was quick, it was easy. It's been an honor to serve on the commission and to try to share your message that even if you think you might not be impacted by COVID, you're young, you're healthy, there's a responsibility and opportunity there to protect your parents, your grandparents, your family, your neighbors, your coworkers. It's important that we all step up to meet the challenge. Governor, we support your goal of seeing that 70% of eligible Michiganders are vaccinated, and I know that we can do this by working together. You have the full commitment and support from the Michigan Chamber and many local chamber colleagues across the state. The Chamber Federation stands with you on this important program and project, and I'm here to say that it's quick, it's easy, the vaccines are safe and reliable. As my friend from Blue Cross Blue Shield said, there is no cost except a little time. So I want to encourage everyone here to roll up your sleeves, to participate in this sweepstakes. Roll up your sleeves, help us continue to move forward together. Roll up your sleeves and get vaccinated for the good of our friends and neighbors and communities. So with that, I would like to introduce our next speakers, Dan Hurley and Robin Lott.
Good morning. My name is Dan Hurley, CEO of the Michigan Association of State Universities, and this is Robin Lott from the state of Michigan. So Carrie had indicated there are 9 scholarships that are going to be included in these sweepstakes in the form of a Michigan Education Trust 4-year contract, and each scholarship is worth supposedly $55,000. But how do you possibly quantify the value of a 4-year college degree from one of our esteemed colleges and universities in Michigan? The benefits that come with earning a degree, in my increased social mobility, job security, job flexibility. Think about how important that has been around the world in the last year. The state's own labor market projections show through 2028 the top 50 highest demand, highest paying occupations, 38 minimally require a 4-year degree. Individuals who possess a college degree are much more likely to live healthier lives, to live longer, and to pass on many positive indicators associated with the degree to future generations of their family. And those with a college degree are much more likely to thrive in careers that they fully enjoy, applying knowledge, skills, and creativity to pursuits that they find deeply interesting and are good at, and make a meaningful contribution to their community, to their occupation, and to society at large. So the value of these scholarships is priceless, because you can't put a price on the benefits that comes with earning a college degree from one of Michigan's many great colleges and universities. I encourage everyone to enter the sweepstakes, especially young adults, as well as parents of middle and high school students who have been vaccinated. By getting a shot, you will get a shot at achieving the American dream through earning a college education via the scholarship sweepstakes. So with that, I want to introduce a good longtime friend, Robin Lott, who has been with the state overseeing financial aid for some 30 years. She just got a well-deserved promotion, so I'm going to let her share her new job title. Robin?
Thank you, Dan. Good morning, and thank you, Governor. I am Robin Lott, Executive Director of the Office of Post-Secondary Financial Planning. It's long, I get it. I have to practice it myself. I've spent 30 years, as he said, as the Met Director, so it's hard to envision that I'm no longer the Met Director. But I'm here on behalf of the Met Director. I'm grateful to be here today on behalf of the State Treasurer of the great state of Michigan, Rachel Eubanks, who also serves as the chairperson for the Michigan Education Trust Board of Directors. So it sort of feels like a reunion, I'd say, a Met reunion. I have Met alumni here, I have Met parents here, and people that support our Fostering Futures youth, and even, I think it's Blue Cross, and Blue Cross that does the payroll deduction for employers. So I'm just excited, very, very excited. So happy that the decision was made to offer young people aged 12 to 17 an opportunity to benefit from the My Shot to Win sweepstakes. So if you're one of the 9 students who win a Met scholarship, like my friend Dan just said, you will indeed be blessed. Met is the nation's first 529 prepaid college tuition program. It's housed within the Michigan Department of Treasury and allows contract holders to secure future college credits at today's prices. With your Met, prepaid earnings keep pace with college tuition inflation and are secured by Met. Friends and family can also contribute to your Met account, which is a great gift idea, especially as paying for college is the second largest expense a person will have in their lifetime, right after buying a house. As the cost of tuition continues to rise, for about 60% of those who graduate, they end up owing, on average, about $30,000 in student loans, compared with about $10,000, which they may have owed back in the 1990s. That's a lot of debt to be saddled onto young workers looking to start families, purchase homes, and begin saving for retirement. So I'm asking parents and guardians of all Michigan students between the ages of 12 and 17 to do 2 things, just 2. First, get your student vaccinated. And second, get entered into the My Shot to Win sweepstakes to be eligible for a Met scholarship. The sweepstakes for the scholarship is open to all eligible individuals who have received at least 1 dose of a COVID-19 vaccination between December 1 of 2020 and July 30th of 2021, and enter the sweepstakes as of August 3rd of 2021. It is required that a parent or legal guardian submit an entry on behalf of a minor aged 12 to 17, and they must provide a parent or legal guardian's information, including their name, address, cell phone number, and email address. So, on that note, again, I'm so excited to be here. What's that song? Oh, what a beautiful morning. It's been a great, great day. So thank you so much. And now let's hear some closing remarks from Protect Michigan Commission Director Carrie Ebersol Singh.
It's a beautiful voice there, Robin. Well, we've given you a lot of information and perspectives about this partnership that we're launching today. So with that, that includes the formal program. We have some time for some questions, and I know the governor has a tight schedule to move on to the next event, but I know many of us are able to stick around to handle questions as well. So with that, it looks like Mike Nolan, 2 questions.
Governor Whitmer, a month and a half ago, we had asked you if this would be possible, and we were told it was against state laws. So what exactly has changed since then?
So I appreciate the question, Eric. You know, when Ohio first went, we examined to see whether or not we could replicate what they did. Of course, we want to do it bigger and better. But Michigan law precluded us from doing it, the gaming statute. I was trying to seek if we could get a change to the gaming statute. That was not something the legislature was interested in, so we pursued other vehicles for doing this, and that's why this partnership powered by Meyer and the United Way is a great way to accomplish the same goal, but through a different means of accomplishing it.
Hi. Governor Pritzker in Illinois has recommended that people bring masks with them even if they're vaccinated because of the deadliness of the Delta variant. Do you see any recommendations like this coming for Michigan in the future?
You know, our focus is getting more and more people vaccinated. Right now, our COVID numbers have just plummeted. I mean, they've not been this low since the virus first showed up in Michigan. So we're feeling good. 62.4% is a good number. I was chatting with someone from Texas. They were envious of where we are. However, it's short of where we want and need to be. We want to get to that 70%. So our efforts, working in partnership with all of these organizations and more, are to get to that 70% number and beyond. As far as the Delta variant, it's real. It is extremely contagious. It's easier to catch, and it can be more deadly, and that's why we're seeking to ensure that people who have not yet been vaccinated have this opportunity, and this is a great incentive. I do not foresee any mask mandates in the future. We've learned that we follow the science and listen to the experts, but at this juncture, we feel very good about where we are. We've got to focus on vaccinations, and that's what this is all about.
Governor, what makes you think that people who've decided not to get the vaccine will now do so because of the sweepstakes?
You know, that's something we don't know, right? But we saw in Ohio and other states that have had sweepstakes that they saw an influx of people coming in to get vaccinated. There are some who simply have some questions, and maybe this will motivate them to seek the answers for their questions so they feel comfortable getting vaccinated and go out and do it and then get registered for the sweepstakes. It's an exciting opportunity for so many people in our state to do what they need to do to protect themselves and our communities, but also get an opportunity to win a big prize. It's a great story of what happens when the public sector and the private sector and the philanthropic sector partner to solve a problem. And we are up to this challenge, and this is a great tool in our arsenal to fight COVID.
Thanks, everyone.
All right, everyone have a great day. If you haven't gotten your shot, do so. If you did, get registered. Let's take my shot to win. All right, thanks, everyone.
Mike said, over 26,000 folks have registered for the sweepstakes already, so.